Today we're going to talk about children's access to adequate nutrition. Sometimes when we think about this topic, we think about it as a historical problem, one in which throughout history people have had a problem with access to food, but one that's now been solved. That's really just not the case. It's not just a historical problem, it's a problem for many people around the world today. In fact, if you look at the data, about 50% of the preventable deaths in children are from malnutrition or related diseases. So it remains a top killer of children around the world and is really a serious problem in many places that needs to be addressed. Globally, if you look at the problem, about 1 in 3 children under the age of 5 experience either malnutrition or is overweight. So it's a huge problem both on both sides of the issue, either not having enough food or having too much of the wrong kinds of foods. Malnutrition causes 2 kinds of primary problems in children: stunting, which is impaired growth, or wasting, which is being too thin for your height. If you look at the obesity problem, the number of overweight children increased on all continents as the Western diet has expanded around the world to almost 20% of children between ages of 5 and 19 as of 2016. Hunger and food insecurity is not just a global problem. There's hungry people in the US, there's hungry people in Iowa City, there's hungry people on campus as well. Unfortunately, some action by Congress this year has made the problem worse. Earlier this year, in 2025, the Big Beautiful Bill that was passed by Congress makes big cuts to the food safety net, including about a 20% cut to SNAP, also known as food stamps, which will add to the hunger and food insecurity issues in Iowa and across the country. Now, sometimes people think, oh, well, cuts in SNAP, that'll be offset by food banks or donations or other ways that people get access to food. However, if you look at the data, people really underestimate how big SNAP is. So for every meal that a food bank provides, SNAP provides 9 meals. So cuts to SNAP really will not be able to be addressed by food banks because there's just simply not the capacity in food banks to make up that amount of additional capacity, because the gap is already really huge in terms of how much SNAP provides and how much food banks provide. And many food banks are already overloaded and stressed to finding enough food for people that need it. In the US, obesity is also a huge, serious problem, with around 20% of children in the US being obese. And obesity in childhood results in lifelong health problems, including diabetes, heart disease, and it makes lots of other conditions like asthma much worse. Looking at the numbers in 2025 globally, the UN says about 343 million people face acute food insecurity across 74 countries. They also talk about catastrophic hunger facing people in Sudan, Gaza, and large portions of South Sudan, Haiti, and Mali. So here's a short video showing more about the crisis in Sudan.
An alarming warning, and it's not new. This is the world's worst humanitarian crisis. Almost 25 million people are facing acute hunger in Sudan, according to the World Food Programme. That's roughly the same as the entire population of Sri Lanka. It's the largest hunger crisis in recent history. Fueled by conflict, this is man-made.
We had to flee because of the fighting and ended up here in Tawila. We have nothing to eat. It's so hard on us. We need many things: shelter from the rain, protection from mosquitoes, food and water. My child here is suffering from malnutrition.
Famine has been declared in various regions of the country, and the United Nations is warning that it's spreading. The fighting is now into its 3rd year, a conflict and human suffering the world has become accustomed to. Despite warnings that it's getting worse by the day, warnings it seems the world has also become used to. Stephanie Decker, Al Jazeera.
In Gaza, the conflict there, UNICEF has estimated more than 50,000 children have been killed or injured from war and the food blockade. And unfortunately, like with all war and conflict, children have experienced a high proportion of the harm and death caused by this conflict. And really, it's a conflict between adults. Children don't really care about the reason that there is a war. They just want to go to school, they want to have a good meal, they want to play with friends, yet too much of the world looks on with indifference. In addition to war and conflict, extreme weather is an important cause of lack of access to food. And extreme weather, as you know, is being made worse by climate change. So for example, some things happening right here in 2025, extreme weather is leading to drought and failure in crop production in countries such as Zimbabwe, Zambia, Malawi. There's wildfires in South America that are destroying farmland, and Guatemala is facing irregular rainfall and high temperatures, which is leading to difficulties in producing enough food for people that live in those countries. Another big challenge is the U.S. has been in the past a major contributor to global food programs. The Trump administration has made big cuts to those food programs, cutting off access to food for about 2.3 million children in low and middle income countries. And that lack of access that they had in the past to food could lead to, based on some estimates, over 300,000 extra child deaths per year, and an increase in malnutrition, related stunting, and wasting in children. Now, famine, war, conflict, natural catastrophes, hurricanes, droughts, those sorts of things are important, but they only cause about 10% of the deaths from hunger and malnutrition. And in fact, most of the deaths with hunger and malnutrition are associated with chronic, long-term lack of access to adequate food. So the problem with this kind of chronic, long-term access is that any kind of disruption to food will be catastrophic. So if you're barely hanging on, barely getting enough calories, barely getting enough food, any kind of bump in the food system, so a drought, change in price, problems with transportation, a conflict in a neighboring country, all of a sudden you're thrust into having severe food problems. So solving chronic food problems really requires addressing structural food issues, not just providing emergency food during famines or war, which is important to do, of course, but addressing those problems on the long-term basis will make those food systems really be able to sustain those kind of bumps and issues more sufficiently to address those longer-term problems. So as we look at strategies for addressing food, one of the best ways to think about strategies is to use what's called the social ecological model. And this is a model that's used in lots of different areas for lots of different problems, but it helps to think about different levels at which challenges and strategies can be addressed. So this particular model has 4 levels. This is from the CDC's violence prevention work, but also it applies to things like food, to education, to all kinds of other areas as well. So what it does is it asks you to think about structures, policies, practices at these different levels, how they interact with each other, and how they work together to achieve success in these areas. So for this particular model, it has 4 levels. So societal is kind of the top level that's looking at the biggest, broadest area of policies, practices, things that are going on at the global and country level. Community is a little bit tighter level, so it's thinking about your local community. What are things that are happening at that level to address this issue? Relationships are kind of that family level. What's going on with you, with your family, with your neighbors, and then the individual level. What are those factors? So we look at some of these factors for food, insecurity, and hunger. At the biggest level, at the societal level, there's things like climate change. Higher food prices are associated with lack of access to food. High food demand, migration, refugees, and low sustainability of food systems are big factors at the societal level. At the more local community level, it's things like food safety systems, having inspections for food, make sure it's safe and healthy to eat, having a safety net like SNAP benefits for those that lose a job or have other challenges in attaining food. Being a long distance from a food store is a problem. If you can't get transportation to a store, if transportation is expensive, then you're reliant on just what's nearby, which often isn't going to meet your health and nutritional needs. Lack of sufficient prenatal and maternal care. So if you recently have given birth or caring for a baby, it's very difficult for you to go out and attain food because you're spending so much of your time caring for that baby. At the family or relationship level, being in a family that's in poverty is a high risk for food insecurity. Having low education of family members, or losing a parent or other caregiver to other diseases such as HIV or COVID or other things like that puts you at high risk for having food insecurity. And then at the individual level, being a woman or a child is a risk factor for food security. Having a disease yourself or having a disability are also risk factors for food insecurity. So the way this model works then is, as you look at those factors at the different levels, you identify strategies that work at those different levels as well. So some strategies to address this will be things like addressing climate change at the societal level, reducing forced migration, reducing conflict that causes that migration and refugee need, increasing universal education, having food safety practices, access to family planning, reproductive health, reducing prices on healthy foods, and funding for low-income families to afford better or more food. And in fact, if you look at the data very carefully, the more money you have to spend on food, the more likely you are to buy healthy food. So if we're looking at the obesity issue, having increased SNAP benefits, more access to lower income families for more money to spend on food makes it more likely for them to purchase healthier foods. At the community level, it's things like clean water, sanitation systems, prenatal and maternal health programs, preventing diseases like COVID and HIV, preventing diarrheal diseases through vaccination programs, community sanitation programs, encouraging local food production to reduce the effect of global food price changes and the need to have complex and complicated and expensive food transportation systems, offering support to be able to grow or produce your food locally, and reducing distance to food stores are important as well. In terms of obesity reduction, things like promoting healthy diets, physical activity, building safe communities and neighborhoods where people can go out safely and exercise and engage in physical activity. So sidewalks and parks and having safe places to be outside and to engage in physical activity is an important community strategy as well. Another thing that's shown some success is what's called sugar-sweetened beverage taxes, which is taxes at the distributor level that reduces the purchase of those types of high sugar, low nutrient drinks. So to summarize, access to food is complex. There's a lot of barriers in the way to getting access to adequate nutrition from people around the world, and there's variation in the causes across regions. But a huge chunk of that is really working to address the structural problems to improve the right to food, which includes things like clean water, education, sanitation, access to production of food, and that really provides improvement to people's lives overall when you do those things. So what are some things you can do? So one of the things you can do in the local level here is you can participate in what's called Hawkeye Meal Share. This is where, for those of you that have a meal plan, you can donate your unused guest meals to students in need at UI. And there's a link here where you can do that, dos.uiowa.edu/assistance/meals-share. You can also request meal assistance through the site if you're in need of food support. There's other ways you can be involved as well. You can volunteer at the UI Food Pantry, which has a couple of locations listed here. You can volunteer locally at the Johnson County Crisis Food Bank, the Coralville, North Liberty, or Iowa City food banks, or through one of the area churches or other agencies that distribute and share food with others. All right, the reading for this week is The Right to Adequate Nutrition. Hope you enjoy the reading and look forward to seeing you in class.